Good morning. I'll wait for things to settle down, but yes, look at all of you. Good morning. So welcome to the 2024 Healthcare Payment Learning and Action Network Summit. I'm Judy Zerzenthul. I'm the Chief Medical Officer at the Washington State Healthcare Authority, and I am delighted to see all of you who have made the trip to Baltimore. We also are hybrid, so hello to our virtual folks, and welcome to all of you. Each year, this event brings together more and more individuals and organizations motivated to advance accountable, value-based care, and we're super excited to see how the ideas and experiences exchanged here today will continue to move our healthcare system towards better access, affordability, and patient experience. This has been a historic year for many reasons, and in value-based care specifically, we find ourselves making progress towards a tipping point. Research and experience indicate that organizations need to get about 60% of their care delivery or their clinical revenue managed under accountable care or value-based contracts in order to be financially and operationally incentivized to manage total costs of care versus the volume of services provided. And we've made a lot of progress in 10 years. As of last year, we were about 24.5% of payments flowing through two-sided financial risk contracts. Moving to that 60% tipping point as an industry is going to mean not only continuing to grow existing investments, but also working with providers not yet participating in value-based care. As we move forward, we must continue to focus on how payment reform enables care transformation required to best serve all people, and we must continue to take action. Over the past year, the LAN has focused its efforts in 5 key areas that help move the needle on industry-wide care delivery transformation. Those areas are continuing to advance primary care, my favorite, integrating specialty care, increasing participation in APMs, incorporating multi-stakeholder views, and using data to address disparities. I'd like to share a quick video highlighting some of the progress of our initiatives and work groups across these areas.
In 2024, the Healthcare Payment Learning and Action Network made great strides in advancing equitable, value-based care, thanks to the many diverse collaborators who participated in its executive forum and strategic initiatives.
Forums like the LAN are really important, and then members are really important to be able to help translate and get the word out about different opportunities for different segments of providers and organizations.
The HCPLAN attracted scores of new people to its in-person and online events, and membership reached a historic high of over 9,600.
Bringing all these parties together, public and private, creates an opportunity to learn faster and learn better the lessons that are relevant to each part of this diverse healthcare ecosystem.
Health equity and social return on investment were among the HCPLAN's priority efforts this year.
Unless we address both the medical and social needs of individuals and communities, we're not going to have the best outcomes.
The Accountable Care Action Collaborative developed a guidance document on incorporating health equity incentives into APM contracts. And the Health Equity Advisory Team developed a grounding document on social return on investment. Quality measure alignment was another 2024 priority.
How do we help ensure alignment in the measures that are in use in value-based programs today? And the state transformation collaboratives are a wonderful example of that.
The National Health Plan Work Group built on the progress of the STCs to move closer to a simplified set of primary care measures. The STCs also promoted other forms of alignment through their new Alignment Landscape, a web-based tool for searching alignment initiatives of all types. Finally, another recent priority, the Person Perspectives Council conducted extensive interviews to produce new industry guidance on what people value most in their healthcare.
I think it's a strategy for understanding how these models are
impacting the people that they're intending to care for.
The year's efforts culminated in the impressive results revealed by the 2024 measurement effort. Careful data collection from plans representing over 93% of covered Americans demonstrated that our healthcare system is making continued progress toward the HCPLAN's 2030 APM goals. As we look to the HCPLAN's 10th anniversary in 2025, join us in maximizing our potential for equitable, value-based care. Learn more about our current and upcoming initiatives at hcplan.org.
In addition to that video, we've also posted a year in review document on our website that can be accessed using the QR code on the posters outside this room. The year in review contains more details about the accomplishments in our priority areas. As you can see, there is so much vital work going on. Before I share a bit more, I'd like to take a moment to honor someone who's been an integral part of this community. As many of you are aware, Jeff Miklos, former executive director of the Healthcare Transformation Task Force and longstanding LAN member, passed away last weekend. Jeff was not only a colleague and leader in the field, but also a dear friend to many here. His smile and enthusiasm could light up the room. In addition to his leadership of the task force and several other industry organizations, he's been an instrumental role in advancing the LAN since its inception. He helped to stand up the Accountable Care Action Collaborative, serving as co-chair. Jeff always gave graciously of his time and expertise, and we're grateful to have had the opportunity to know him, to work beside him, and to learn from him. Our thoughts are with his family during this difficult time. Jeff knew many of you here today. We hope you can find time and space to reflect on Jeff's life, his impact on the healthcare community, and the joy he brought to those he knew. The LAN's work would not be possible without the thought leadership, strategic direction, and committed action of the members of our executive forum, strategic initiatives, and leaders like Jeff. I'd like to take a moment now to thank all of our members for their tremendous contributions of time and energy over the past year. I also want to recognize the new members of the executive forum, strategic initiatives and work groups, including CVS Health, the National Association of Chain Drug Stores, the Academy of Nutrition and Dietetics, and US of Care. Last but not least, I'd like to acknowledge the work of our newest work group, one that I am personally very excited about, our Person Perspectives Council, made up of the National Partnership for Women and Families, Community Catalysts, PFCC Partners, and Families USA. Now, I'd like to provide some more information about what you can expect from this year's summit. We've got a lot of great content today, including plenaries and breakouts. We're going to start the day by grounding our discussions in person-centered value-based care, talking about advances in industry trends that improve access, affordability, and experience for individuals, their families, caregivers, and communities. Following this grounding discussion, the day roughly follows the value-based care journey of many of our stakeholders and members. The first 4 sessions focus on the foundational elements needed: aligned quality measures, the building blocks of equity-driven arrangements, standardized data sharing, and a common care delivery foundation. During the second block of breakout sessions, we'll transition to hearing about specific use cases of these foundations in action: health equity programs that incorporate people and communities, organizations operationalizing use cases for bulk fire, moonshots and belly flops, and what promising practices and lessons learned we can all take from these experiences. Belly flops and failures are part of the journey. That panel will be talking about some of the big ideas various organizations have been testing out, sometimes successfully, but sometimes not so successfully. And I'm excited to join that conversation and share more about our experiences in Washington State. The last block focuses on what's to come. We'll discuss measurement tactics that can help us continue to evolve and innovate, as well as some areas most primed for growth to increase access to quality care and care transformation. We're looking forward to hearing from the purchaser community and from organizations serving rural communities during these forward-looking sessions. We'll finish the day up by unveiling the results of this year's measurement effort. Every year since 2015, the LAN has measured how much progress the American healthcare system has made towards adopting APMs and accountable care, and we look forward to sharing this year's numbers. It's nearly time for me to turn over the stage to our first panel, but I do have a couple of housekeeping items to mention. We hope our hybrid format offers a way for everyone to maximize their summit experience. All of our plenary sessions and one of each of our 3 breakout sessions will be streamed live. Our LAN Summit agenda online indicates which sessions will be live streamed. You'll want to keep your silent phones handy, not just to follow the agenda and choose your breakout sessions, but also to get real-time feedback from you through short polls. We'll be using Poll Everywhere for in-person and Zoom for those of you virtually, and we use this data to improve the summit year over year. Thank you for your participation in this evaluation. As in recent years, much of this summit is being recorded and will be available on the summit website in the weeks ahead. And now, it's time to officially kick off the 2024 LAN Summit. It's my pleasure to welcome to the stage Kate Davidson, Director of the Learning and Diffusion Group at CMS Innovation Center and the moderator of our Transforming Healthcare Fireside Chat. During these first discussions, you're going to hear from several CMS leaders as well as my Executive Forum co-chairs as they reflect on recent advances and major trends shaping care delivery transformation. Thank you all again, and let's talk and take some action.